Radiation has profound effects on the human body. Radiation workers are often exposed to high levels of radiation. The hazmat suits that they wear provides protection from only certain types of radiation. Only alpha and beta waves are stopped. However, gamma and X-rays pass right through the suit. After watching this video, I hope companies provide radiation workers with better protection. What is radiation? Radiation is the emission of energy in the form of electromagnetic waves or moving as subatomic particles. Most electromagnetic waves aren't harmful. However, if you move down the electromagnetic spectrum, the waves get shorter and hold more energy. The safe kind of electromagnetic waves include visible light, microwaves, infrared, and radio waves, which are called non-ionizing radiation. At the further end of the spectrum, there are X-rays, ultraviolet, and gamma rays, which are more powerful and are dangerous. They are produced when an unstable atom's nucleus decays, releasing ionizing particles such as electrons, neutrons, protons, and energy in an attempt to stabilize themselves. This is called ionizing radiation. An atom is stable when it satisfies the octet rule. It must have 8 electrons in the outermost orbit. If it doesn't meet this rule, it becomes unstable. Polonium, plutonium, and uranium are all examples of elements which release ionizing radiation. This radiation can cause a lot of damage, like burns, cancer, and even death. Radiation is measured in sieverts. As higher doses are given, more damage is sustained, with exposure to 0 to 250 microsieverts. No damage is done. With 250 to 1000 microsieverts, some people may lose their appetite, have nausea, and have mild spleen, bone marrow, and lymph node damage. At 1000 to 3000 microsieverts, the nausea is mild to severe, no appetite, and have higher susceptibility to infections. Severe injuries to the bone marrow, spleen, and lymph nodes occur. Most victims survive this exposure. 3000 to 6000 microsieverts causes severe nausea, no appetite, a serious risk of infection, diarrhea, the skin starts to peel, and sterility. If left untreated, the victim will die. At 6000 to 10,000 microsieverts, the victim will have the symptoms previously mentioned, plus severe damage to the central nervous system. At 10,000 plus microsieverts, the victim has a high chance of death, but those who live will have a higher chance of developing cancer, such as lung cancer, thyroid cancer, breast cancer, leukemia, or cancer of several organs. Radiation fibrosis is the formation of scar tissue from radiation. Tissue becomes less stretchy, which can lead to complications, such as your bladder becomes less stretchy, thus holding less urine, so you need to pass urine more often, shortness of breath caused by your lungs being less stretchy, narrowing of the food pipe, also known as the esophagus, making it difficult to swallow, called radiation esophagitis. The lungs are very sensitive to radiation and can cause lung cell death. This can result in radiation pneumonitis. Radiation pneumonitis is the inflammation of the lungs caused by radiation. Lung cells called pneumonocytes undergo apoptosis, in which the cell kills itself so it doesn't spread its damaged DNA. The DNA damage occurs due to the radiation. Symptoms include a fever caused by the inflammation in the lungs, a cough which can be either productive or non-productive, meaning the patient can either cough mucus or not, chest congestion caused by the inflammation, shortness of breath due to the decreased amount of pneumonocytes or lung cells, and chest discomfort. Treatments include decongestants, cough suppressants, corticosteroids to reduce inflammation, and bronchodilators to widen the airway. Bronchodilators work by relaxing the muscles around the bronchi, allowing for better airflow to the lungs. Corticosteroids work by mimicking the effects of a hormone produced in the adrenal gland, called cortisol.